Hi, welcome to lecture 4. We'll talk more about the demand and supply in healthcare, how economic forces shape access, pricing, and service delivery. Firstly, what is demand in healthcare? It is the willingness and the ability to seek healthcare services. First, there's this concept of KAP, knowledge, attitude, practice. So first, you must know there's a service or you know there's a treatment. That's the knowledge part. Attitude, you must feel that the condition is important enough, severe enough to see a doctor, to see a healthcare service. And finally, you must actually do it. So this is called KAP, knowledge, attitude, and practice. This is demand is influenced by price, the price of services. All else being equal, the lower the price, the greater the demand. However, in healthcare, we consider healthcare as a credence goods, which we'll cover more in the next lecture. What this means is that if care is cheap or free, it may be low quality of care that no one wants to know. So pricing could be a signal that it's good quality care. So some patients may willing to pay more just to think that they are seeking the best care or most expensive care. Income. All else being equal, the higher income can afford higher price products. The need, same thing, if you feel there's a greater need, then you go for the healthcare services. Awareness, I kind of covered this in the first part. Attitude, knowledge, attitude, as well as practices. Culture, is it culturally acceptable to seek care? For example, in Singapore, we do have traditional Chinese medication, so some patients seek this instead of the Western health services. Important thing to note is demand is not necessarily equals to need. Not everyone who needs care seek it. This is very important. So a lot of time they say the crying baby gets the milk. So a lot of times people who demand the care may not be the one needing the care. This is a very good example in the accident and emergency department where people with minor condition may actually demand the care. It does not necessarily mean they need to be seen at the accident and emergency department. What are the factors affecting demand? One is the price, as mentioned. Price is affects if you have paid out of pocket. But most of the healthcare services are subsidized, and most of them are actually covered by insurance. So your insurance, your coverage will affect it. So the more insurance you are covered, the less out of pocket you pay, the more likely that you will seek the care. Perceived severity and benefit, quite similar. You must think that your condition is severe enough and that the treatment benefits you. So if the treatment doesn't benefit you, you'll not see the care. For example, recently I saw a patient. This patient asked me if I want to do an MRI of my knee, but I don't want to go for any knee surgery. Do I still need to do the MRI? So the outcome of the patient is that they're not keen for the surgery. Do you still refer them to see a surgeon? This is a very interesting question. So to answer the question is I not too satisfactory, but I told the patient go and see the specialist. He or she will decide whether you need the specialized investigation. Accessibility and convenience. Of course, if the hospital, the health services is located nearby, it's very accessible. More likely or not, you will actually demand it. But if you have to make a whole trip to go, that is another thing that you need to consider. For example, in Singapore, there are patients who actually travel to a further hospital just because there's better public transport linkages. Having said that, in Singapore, we're not quite centralized, so I think distance or time traveling may not really affect the accessibility to care. Public health messaging very important. So in the early 1990s, I think there was a TV drama in Japan on HIV. So after that show was shown, a lot of people actually sought care. So public health messaging norms are very important. For example, vaccination for COVID. Again, the mass media has been useful in trying to convey the message that go for vaccination because this is the best protection against the COVID virus. What is supply in healthcare? So this is another thing. After you talk about demand, now talk about supply. Supply is actually a quantity of healthcare services provided willing to offer. So this is very interesting. So in UK, for example, tax are quite high. So if you are in a certain tax bracket, you may not want to work so hard because if you have to work harder, you may actually end up earning less because of the higher tax rate. So in doctors tend to have this thing called a target income. So once you reach the target income, you wouldn't want to work that many hours. So this is a balance between the price they get. Pay them too little, they will move out of the country. Pay them too much, then they will not work. This is very similar to inheritance for children. You want to leave your children just enough that they can do anything, but not too much that they do nothing. Other thing consider for supply is capacity, cost, regulation, incentive. So capacity is basically a medical school. How many doctors can you train? Your nursing school, how many can you train? And not just that, can you attract people to come to Singapore to practice as a doctor or a nurse? These are some of the things you need to consider. Cost, how much does it cost? As well as the regulation. In Singapore, if you want to practice Western medicine, you need to be registered. So if you are not from certain schools, you cannot work in Singapore. If you're from certain schools, you can work in Singapore under supervision of a senior doctor or someone who is registered. So all these things are regulation. Incentives matters, as I mentioned. So if you want to reward providers to do more, a fee for service is generally the best method. But that is incentive is for we cover this more on payment mechanism. Now influenced by the availability of staff, equipment, OT, facility, beds, and infrastructure. So all these things are things to consider. Some of supply constraint, a lot of health system is workforce shortages. Just read article that there are a nursing shortage everywhere, especially China. So typically, Philippines, for example, Philippines provide a lot of nurses for a lot of countries. So during COVID-19, I think if I'm not wrong, there was a regulation to prevent them from traveling out of Philippines, and that actually caused a lot of healthcare shortages in a lot of countries. But now I think the ban has been lifted, so Filipino nurses can actually work overseas. Limitation in hospital beds and equipment. There's this law called Romulus law, which means that in a covered system, every bed built is a bed filled. So in this kind of system, you may not want to build too many beds. Because of that, there's actually limited hospital bed because of the fear of overcapacity. Equipment-wise, MRI machines, OT facilities, all these things are limited. So there are some things you need to consider. Geographical distribution of services. So Singapore is quite lucky. We are quite small. But countries that are big like Malaysia, like Australia, US, they are rural areas. So these areas they may not have the care. So in Australia, you live very far away from the city center. You may be highly evacuated to the nearby to the city hospital, especially if the rural hospital cannot manage the care. Regulation, as mentioned, so these are some of the bottleneck. You need to be registered as a doctor, as a nurse, as a pharmacy before you can practice. And there's some licensing bottleneck in the sense that only certain schools are recognized. So it's quite interesting because imagine you're the worst student in the school that's recognized versus the best student in the school that's not recognized. It's not very fair that the worst student in the school that's recognized is being accepted, but then the best student in an unrecognized school are not. So there are some things to think of. What happens when demand more than supply? When demand doesn't meet the supply. Correct. When demand is higher than supply. Yeah. Okay, anyway, when demand is not the same as supply. So first, assess demand. This leads to waiting time, rationing of care, unmet needs, people price out of the market, too expensive, they don't seek care because it's too long, too expensive. Assess supply, a very wasted thing because there's underutilization of resources. There's this thing called induced demand. So providers are the best. There's asymmetrical information. So providers can tell you that you need to go for X-ray, for tests, where you may not really need to because it's quite unlikely that you have a fracture. For example, if I can weight bear, you can your mobility is full, so you may not really need investigation. So, but you can actually induce the demand. Health economics seeks to balance demand and supply efficiency. You may not always get it right, but we try to. So in summary, demand and supply are central to healthcare access as well as delivery. Imbalances can lead to inefficiency or unfairness, inequity. So let's do a reflection. In your setting, wherever you come from, where have you seen demand exceed supply? Hopefully, I don't hope that you don't see supply exceeding demand. Thank you for listening and have a good day ahead.